Most women who are presenting with nipple discharge or discharge from their breast normally think of breast cancer. But I want to tell you today that most causes of nipple discharge are not even related to breast cancer. So in today's video, we are going to discuss about normal nipple discharge, abnormal nipple discharge, what are the possible causes of this nipple discharge, what are the laboratory stroke imaging investigation that we can do to help us in diagnosing a nipple discharge, and how we can manage nipple discharge. If you have not subscribed to this particular channel, hit the notification bell, written subscribe, turn it on for more videos that I will post. Now let's go and let's do it. Nipple discharge can be normal in that it can be clear, it can be yellow, it can be brown, green or white, and this one normally occurs in both breast and occurs only when the breasts are squeezed or the nipples are squeezed and comes from several milk ducts of the breast. But we normally say that the color of the breast nipple discharge is not a better way of diagnosing breast disorders, in that there can be normal or abnormal discharge related to the color. Kindly note that when nipple discharge is not normal, then it may be bloody and it's occurring only in one side of the breast. It comes out on its own without squeezing or even touching this particular nipple, and it can be also accompanied by symptoms like pain, redness, or even swelling and changes in this particular nipple. Now, if you note this, this can be due to abnormality in nipple discharge. And there are several causes that I want us to take into consideration. And one of the major causes of nipple discharge is hormonal imbalance. Hormonal imbalance can occur during a menstruation period or during perimenopause or even menopause. When there is pregnancy or during lactation, and this is normal, this is a discharge that everyone knows, and this is milk which is due to breastfeeding or even pregnancy, and that is normally normal. Birth control pills can affect your hormones, and this one can result into nipple discharge. Drugs such as antihypertensives and antidepressant can cause nipple discharge. Antihypertensives like methyl dopa can also cause this, and even antidepressants such as paroxetine can also cause this particular breast discharge. Non-cancerous breast cyst or breast swelling as a result of a cyst can result into nipple discharge, and most of these discharge are greenish in color and does not show any sign of breast cancer. Now, when you have you put on a tight brassiere, or your clothes can be constantly in friction with this your breast or your nipple, and this can result into nipple discharge. When you have your partner and you are sexually aroused in women, and this one can result into breast discharge or a nipple discharge because of the increased prolactin level. Injuries of the breast can also play a very, very important role in nipple discharge. Stress management is very, very key, because those who are psychologically stressed, those who are stressed in that they cannot manage this particular stress of theirs, these females tends to have increased prolactin levels, which normally induce the discharge. So we normally advise for stress management, if at all you are undergoing such a psychological torture, or you are experiencing some kind of stress. It is very, very important, because this one normally brings discharge. Now, there are people who have been diagnosed with papilloma, breast papillomas, and these are non-cancerous growth that does normally affect the breast, and sometimes they can be clear discharge or even bloody discharge. So breast papilloma or papilloma can be diagnosed through ultrasound, even MRI, even CT scan. So this one can also bring a discharge from your breast. Breast infections like abscess can also bring discharge, and most of these discharges are yellow in color. There's a impression we call mammary duct ectasia, when the mammary ducts are widened, and this normally pose great risk, and this brings a lot of discharge in your breast. When we check your thyroid functions, and there's a condition we call hypothyroidism, where there's a reduced thyroxine levels. Pituitary gland tumors such as adenomas, or what we call prolactinoma, due to increased prolactin levels, can bring what we call milky discharge. This is due to that tumor called prolactinoma, and this can result into your breast discharging milk. Fibrocystic breast tumors or breast disease can bring breast discharge, and lastly, we have what we call breast cancer, of which people are normally fearing, and this normally is very, very rare, but if it occurs, it's a clear discharge from your breast. So for us to diagnose this particular problem, or to find the reasons for your breast or nipple discharge, we need to do thyroid function test to rule out what we call hypothyroidism, that is the reduced T3 and T4 levels. And also we need to know the levels of prolactin in your blood, because we talked about prolactinemia, which normally causes nipple discharge, particularly those who are suffering from what we call pituitary gland tumor, the prolactinoma I was talking about. Mammography, x-ray of the breast, or even ultrasound of the breast, that is called mammogram, is very, very helpful, particularly in diagnosing papillomas, abscess, or mammary duct ectasia, or even fibrocystic breast, or even sort of few changes in the breast as a result of breast cancer. CT scan, very, very vital. CT scan of the brain will help us to rule out what we call prolactinoma. The one I've talked about. Biopsy, that is, we take a chunk of tissue from your breast, and then we subject it to what we call histology, histopathology, and we find out whether it is cancerous or non-cancerous. Ductogram is also very important. It's a method of mammogram that is normally helping in diagnosing this particular problem. And of course, now management is usually case by case. From all those causes and investigation, when we find that it is due to drugs, then we isolate the offending drug. If it is due to infection, we introduce those antibiotics. If it is breast abscess, we can even do incision and drainage. And even if it is due to papilloma, we can do lumpectomy, or we can remove those particular lumps that are there. We can do ductectomy or microductectomy, just to protect and to drain all those discharges that are coming from the ducts that are affected. So those who normally have a lot of fear that if they have breast discharge or nipple discharge, what is ringing in their mind is breast cancer. Before you even think of breast cancers, all those particular screening must be done to arrive at correct diagnosis. If you have not watched the live video I did about nipple discharge, It may appear in one of this particular video that's appearing in between this discussion. Otherwise, if you have not subscribed to this channel, hit the notification bell, written subscribe, turn it on for more videos that I will post. Muchas gracias. See you in the next video.